Well, some of the medical technicians at Mayo are using a new cutting-edge diagnostic machine. It's called a virtual biopsy. It's a machine that uses a less invasive way to do procedures such as colonoscopies. Tiffany Baker has more.
Dr. Michael Wallace is a gastroenterologist at the Mayo Clinic. His specialty is the intestines. Wallace is conducting trials of cutting-edge technology designed to actually diagnose colon cancer without ever cutting into the patient.
As we can look at a polyp, determine if it's benign, and if it is, we don't need to remove it. Whereas if it's a precancerous polyp, we would go ahead and remove it right then and there.
This is good news for patients like Diane Roma, who undergo routine colonoscopies. Roma was not a part of the trial, but she hopes the technology is available to the public someday. She says the anxiety of waiting for the results is worse than the actual colonoscopy itself.
Thinking, oh my gosh, it could be cancer, and then what's going to happen with my family, and just build it way out of proportion, where this knowing right away would be just a blessing.
Dr. Wallace uses a miniature microscope to examine a polyp and determine whether or not it's malignant without ever having to remove it and send it to the lab. Wallace describes the probe as a 3-foot-long spaghetti noodle, which makes it very easy on the patient. Mayo is the only medical facility in the Southeast that uses the virtual biopsy. But it's not just being used for the colon, it's also being used for other areas of the body.
And that includes studies looking at the esophagus in people with chronic heartburn or acid reflux, looking in the stomach in people who have precancerous changes in the stomach, even looking inside the bile duct and the pancreas in patients who have cancerous changes in the pancreas or bile duct. We're also looking in other organs outside of the GI tract.
Roma didn't have any polyps, but she'll continue to be tested at regular intervals when she hopes she can take advantage of the new non-invasive test. Tiffany Baker, Inside Jacksonville.
Colon cancer is the second deadliest form of cancer, only behind lung cancer.
The virtual biopsy allows doctors to diagnose and treat the disease on the spot.